Welcome to tonight's call, where we're going to discuss herpes simplex type 1 and neurologic symptoms. And HSV-1 is the how you refer to it in the short way. And HSV-1 in the research is shown to be a driver of trigeminal neuralgia, Bell's palsy, vertigo, and Alzheimer's disease. So we'll talk about the mechanisms of that tonight. And it's not limited to that. You could have something that doesn't fit these diagnoses, such as just dizziness or vertigo or anxiety or something like that, your doctor's tested you many ways and always tells you you're normal, but they haven't investigated an infectious cause, and it might be a herpes family virus like HSV-1. So let's dive in. Gone viral. The world's gone viral. If you've been alive in 2020 and beyond, you know that. But this video is about the herpes family viruses, which are actually far more common than the COVID virus. And so when we're talking about herpes family viruses, we're not talking about sexually transmitted diseases only. That would be HSV-2, and that's included in the herpes family of viruses. But we're talking about herpes family viruses overall, most of which are not STDs. HSV-2 is the STD, the rest are not. And those are HSV-1, which is herpes simplex 1, which is the main focus of today's video. And that drives cold sores primarily, or most commonly, we should say. Then there's Epstein-Barr virus, which is most well known for being the causal virus for mono. There's human herpes virus 6 and 7 and 8, and they can be associated with multiple sclerosis or Alzheimer's disease. There's cytomegalovirus. There's a whole group of them. So when we say gone viral, we're talking about herpes family viruses, and these are the most common viruses on the planet. If we tested the planet, up to 95% of people would show evidence of past infection of one or more of these viruses. So they're potentially very relevant in any case that walks into the office, especially cases that have not responded to care that you would think typically would solve the case. So you want to investigate for these. Now, these viruses infect us at a site, say an epithelial site, so maybe the lips or the skin or the sinuses or something like that. And they ultimately make their way into the central nervous system, and they become latent in the central nervous system, meaning you have an acute infection, say, of herpes simplex 1, you express a cold sore on your lip, the immune system beats it, but while it was fighting it, some virus was traveling into the central nervous system and ultimately took up space in your neurons and goes latent. And latent, you could picture as, a bear hibernating. They're just there, but they're not having a clinical impact typically. They're just there waiting for a chance to reactivate and express themselves and cause issues. And this is why it could be relevant for you at any time of your life, not just, when you were 14 and kissed that boy and developed mono from an Epstein-Barr perspective. Okay, yes, you had mono when you were 14, say, but now you have Epstein-Barr in your nervous system forever. And now when you're 45 and you go through a divorce and you're not sleeping well and you're a single mom, all that stress may add up to suppress your immune system enough that now the latent Epstein-Barr virus reactivates, and now you have chronic fatigue syndrome from a virus that you picked up when you were 14. And none of your doctors are looking for that because your symptoms started when you were 45. So why even go back to when you were 14 and care about what happened then? This is why. And so that can happen with any of these herpes family viruses. So let's dive into the research to understand that further. This is the American Journal of Pathology from 2003, and it's talking about latent herpes virus infection in human trigeminal ganglia causes chronic immune response. So it's a mouthful, but essentially the trigeminal ganglia, if we back up, let's look at this study, which we'll jump to Again, this is more recent. This is a 2019 study in Frontiers of Cellular Neuroscience, and they're looking at HSV-1 in the nervous system and how it relates to neurodegenerative disorders like Alzheimer's disease. But it has a great graphic to help us understand the infectious process. So here you can see that when you have, say you have infection, you have HSV virus of the nose or the olfactory route. Okay, so you inhale some HSV-1, you have infection, you express maybe, you could be symptomatic or asymptomatic. So you may express cold sores, or you may never show signs of HSV-1 infection. So you would say, I've never had HSV-1, but you could be infected without symptoms. So it enters the nose, goes through the olfactory epithelium, or the barrier of the nose, enters the olfactory bulb, which is part of the nervous system and how you smell, and travels to the brain that way. And then it takes up residence in the brain and waits for an opportunity to reactivate. And you can see down here at C, where it says 1, 2, 3, 4, up in the graphic, you can see that the virus will travel from it can travel from the olfactory bulb, it can travel from the trigeminal nerve ganglia to site 1, to site 2, 3, and 4. So there's different areas in the brain that they can go take up residence, and depending on where they take up residence could impact symptoms. For example, if they take up residence in the frontal cortex, that's our executive functioning area. So if they reactivate there and drive inflammation in that area, perhaps you experience anxiety or depression or brain fog or inability to concentrate. If they take up residence at point 3, that's the hippocampus. That's the main area of short-term memory in the brain. So if they damage neurons there, you may develop dementia, and Alzheimer's disease is loss of short-term memory, right? It's dementia. If they take up residence in point 4, that's the cerebellum. Well, the cerebellum integrates the entire brain and nervous system. The cerebellum drives balance and coordination of movement, of thought, of speech. So you may have dizziness, you may have dysmetric speech, it's called, or stutter, things like that. You may have neuropsychiatric symptoms, like because your thoughts are off. So there's no really limit to how that could impact you. So that's how they take up residence in the nervous system. Now, if we go back to the study, the trigeminal ganglia in that picture is right here. And a ganglia is just a group of nerves. Say it's the train station, and from that train station, a lot of different tracks leave. So you can see the red track down the draw line here. That's one part of the trigeminal nerve. Then the blue part is the second. That's the maxillary branch going along the cheek and under the eye. And then the yellow part is the third branch going up above the eye to the forehead. And so the virus will accumulate in the ganglia and then travel out different nerve branches and cause symptoms along those branches. So if you've heard of trigeminal neuralgia, the trigeminal nerve leaves that ganglia and supplies the face. So if you have trigeminal neuralgia symptoms, you may have facial pain, you may have hemifacial spasm, you may have issues with gland function and dry mouth or dry eye or things of that nature. It's broad and depends on the person. This study shows that it wasn't this study, it was the other one, shows that the persistence and latency of the virus occurs in the trigeminal ganglia, also the facial ganglia, and the vestibular ganglia. So the vestibular ganglia, the vestibular system is your balance and your coordination. If you lose it, you may have vertigo, you may have dizziness, you may have issues like that. So there's potential for vertigo and dizziness to be virally driven, and that's not often a cause that's pursued in conventional medicine. So what would trigger reactivation of the herpes family viruses? UV light can do it, fever or infection with another microbe can do it, stress can do it, immune suppression for any reason can do it. So basically anything that knocks you down can promote immune suppression and reactivation of the virus. And the reason the immune suppression is important is because the immune system is what is keeping these viruses latent. So I picture it as you kick the virus into the corner and the immune system puts the red dot on the forehead of the virus, right? And is saying, make my day, right? So if your immune system gets suppressed or knocked down for any reason, now you don't have the red dots on their forehead and they reactivate and have a party because it's like, hey, there's no surveillance on us. Let's take this opportunity to express ourselves. And so the T cell mediated immunity is very important in keeping them kicked in the corner. And the cells that are of most importance there so far from the research is the CD8 positive T cells. And what the research finds is that when you see, or when the viruses take up shop in the ganglia or around various neurons, around the neurons with latent virus are CD8 T cells, our immune cells, surveilling them, waiting, keeping them latent. And in order to do this, there's this chronic inflammatory response, right? Because it keeps the immune system alert, keeps them focused. So the infection, even with latent virus, whether you're symptomatic or asymptomatic, promotes a chronic immune response. And that's what this study was about. So it's important for us to have optimal antiviral immune defenses so that we can keep these at bay and not allow them to reactivate and drive things such as encephalitis or long-term Alzheimer's disease or multiple sclerosis. So that's the main information I want to pull out of here. Relevant to HSV-1, we talked earlier how if we tested the planet, 95% of the planet would show evidence of some form of herpes family virus. Well, specific to HSV-1, it's usually acquired in childhood, and then worldwide, 60% of the population shows antibodies against the virus, which would suggest that they've been exposed to it in their life. But only 20 to 40% of those that are infected develop symptoms. So that leaves another 20 to 40% of people who are asymptomatic carriers and still susceptible for reactivation and the effects of reactivation. And so we want to live a lifestyle that promotes optimal immune surveillance and defense so that those things don't happen. Therefore, decreasing our risk of things like trigeminal neuralgia or Bell's palsy or Alzheimer's disease or vertigo or whatever we're trying to avoid. So I think this is important in the context of quality of life in general, but also in the context of many people are suffering from issues that conventional medicine can't explain and isn't evaluating as thoroughly as we like because they're not evaluating for these infections. When conventional medicine looks for tests antibodies for these, they'll run, say, an Epstein-Barr virus panel, and the way that you assess for, or the way that conventional medicine assesses for acute infection is they want to see IgM antibodies to the virus. So, for example, in an Epstein-Barr virus panel, there would be Epstein-Barr virus VCA-IgM, VCA-IgG, and EBNA IgG typically. And you don't have to worry about what that is, just know it's 3 different markers. Well, if the IgM is negative, your doctor's going to say it's not an acute infection. These positive IgGs just mean you've had it in the past. So they move on, ignore it as a potential contributor to your case, and you leave not feeling any better and maybe more hopeless because you think that they're up to date on immunology, so you trust them. But current immunology says that you can have acute reactivation of the Epstein-Barr virus or the Herpes Simplex virus or the cytomegalovirus with IgG only lab high titers. So it's important to be aware of that and work with a practitioner that understands that and how to address that, because again, this could be a silent driver of your suffering that is never going to be addressed in a conventional model. So that's all I wanted to talk about on that. Let's open it up for questions and see what we get.
I have a question. Is there a cure for this HSV-1?
There's not a cure because it's there. The cure is to drive it back into latency. So there's no way that you're going to get rid of the virus. They take hold, they're inside your neurons. So it's now the key is that there's two forms. There's latency. Let's show you that. There's latency and there's lytic phase. So HSV-1 can alternate between a lytic infection phase that produces infection or a latent state characterized by undetectable levels of the virus in the individual's blood. So if someone's showing up with acute symptoms and reactivation, we want to promote the driving of the virus back into latency and then a robust Th1 immune response and CD8 positive cells to keep them there. Keep the red dot on the forehead, not let them back out. Does that make sense?
You basically want to get your immune system up to snuff, right?
Yes, because that's the determinant of whether they're going to stay latent or reactivated ultimately.
So I have a question for you. Okay, so I had tested positive for this plus Epstein-Barr.
Mhm.
And so it's like, okay, what, you know, when you finish your 12-week program or your second 12-week program and, you know, you have that planned attrition and all of that, and then you're coming off of everything and you're like, it's really difficult to not feel like I'm not doing enough now because I'm off of everything.
Yeah.
And so how, like, do you just keep maintaining, you know, like what can you do to make sure, or do you have to wait until maybe something rears its ugly head, or, you know what I'm saying? Like, how do you do that?
No, so what you could do is do periodic lab check-ins, right?
Right.
And make sure under the hood is doing as well as you feel, right?
Okay.
And that's why we don't want to go by how we feel all the time, because, you know, a lot of people feel great, ran a marathon yesterday and had a heart attack tomorrow. You know, actually, my mom texted me today and said, what would cause an aorta to tear? Because apparently she has a friend at church who was fine Sunday, fine yesterday, and is dead today because her aorta ruptured.
Oh.
So, you know, it's like, we got to enjoy every moment we have. And just because we feel good doesn't mean we're functioning well or healthy.
Right.
So periodic check-ins. Now that's going to vary by patient. Maybe that's once every 4 months or 6 months or 12 months. That's patient specific. But to answer your question, remember that the goal is to get where we say, Jennifer, spread your wings, go be consistent in the lifestyle that got you here. And now, you know, where before the supplements were doing a lot of the heavier lifting, we want to shift that to, okay, there's less supplements and now lifestyle is the big piece.
Okay.
And so, you know, we've talked a lot about immune system and what promotes optimal antiviral defenses. So it goes back to the lame, boring stuff of proper nutrition, proper sleep, physical activity, you know, sun exposure, earthing, all that stuff.
Right.
Lower stress.
Lower stress.
Yep. And yeah, exactly. Thank you, Scott. Because stress suppresses immune function. And so the more stressed you are, and what do we see? If you know people with HSV-1 or with shingles, what happens? They get knocked down for whatever reason and they have cold sores develop, or they have a shingles outbreak on their ribs or something, right?
Yes. So
that is real life. That is the stress knocked down their immune surveillance, red dots off the forehead, party. Shingles live in the dorsal root ganglia along your spinal cord. So they're going to go along the nerve root that they're living in. The HSV-1 could be anywhere. So it might be a cold sore, might be a hemifacial spasm, might be dizziness, might be anxiety, depends on where and what part of the brain or central nervous system they're impacting.
Okay. Yeah.
So there's
it's like we don't want to get like so you don't want to rely on supplements when you should be relying on how you're living now.
Yeah.
So,
That's the more important part, you know, because if you take all your supplements and go to McDonald's, you know, what's the point, right?
yeah,
So
that's the point.
ultimately, we have to be living right, and that's the most sustainable way long term, because it's most of that stuff is free once you've learned it, right? So
Right.
yeah, it's boring and not sexy, but it's really the key. The key.
No, it is sexy.
Yeah, Scott is. Look how svelte he is.
No,
So,
but thank you for that.
but seriously, then we reserve the supplements to when we need a heavier hammer,
Okay.
right?
Yep. Very helpful.